Assalamualaikum everyone. In this video we are going to start the ENT series. First we will cover the portion of the ear. In today's video we are going to study the anatomy of the ear. So let's dig into it. Ear. Ear is the organ of hearing and balance in the human body. This ear is further divided into external, middle and the internal ear. The external ear consists of further parts. The outermost part is the auricle, that is also known as pinna. The middle part is the external acoustic canal, and the innermost part is the tympanic membrane. Auricle and pinna is the outermost part of the external ear. It is composed of yellow elastic cartilage and the skin. This cartilage is absent in two areas, lobule and incisor terminalis. Now we will discuss the basic anatomy of the auricle and pinna. The outermost rim that continues from the insertion of ear superiorly to the lobule inferiorly is known as the helix. This helix is basically continued along with the crest of the helix. The inferior ridge that is present parallel with the helix is known as the antihelix. Superiorly, this antihelix is divided into two crests, superior and inferior crest, enclosing the triangular fossa. This crest of helix basically divides the cavity concha into two portions. The upper one is the concha cava and the lower one is the concha cava. There is the protrusion of skin along with the cartilage on the inferior portion of the ear known as the tragus. There is a ridge behind the tragus known as the antitragus. The area between the tragus and antitragus is known as the intertragus notch. There is an area between the tragus and crest of helix known as the incisor terminalis. As we already discussed this, there is the absence of the cartilage in this portion. This makes this portion so important for surgical approach to external acoustic meatus and the mastoid. And last one is the lobule. We also use pinna as a grafting material for various surgeries of nose and other portions of the body. Coming towards the second part of the external ear, that is the external acoustic canal. It extends from the concha to the tympanic membrane. When we watch it superiorly, it consists of two parts. The outer part is more upward and backward, while lower part is downward and forward. That's why we have to pull the pinna upward and backward to bring the two parts in alignment. The outer part is also known as the cartilaginous part. It forms the outer 1/3 of the tympanic membrane. On the lower lining of this cartilaginous part, there are two openings or fissures known as the fissures of Santorini. They basically form a passage between external acoustic canal and the parotid gland in the facial region. That's why they causes the transfer of infections from parotid gland to the external acoustic canal and vice versa. Here the skin is thick, containing the pilosebaceous glands that produces the wax. It also contains hair. That's why the furuncle infections, staphylococcal infections of the hair follicles is most common only in this part of the external acoustic canal. The innermost part is also called the bony part. It forms 2/3 of the inner portions of tympanic membrane. Here the skin is thin with absence of any gland and the hair. As we know that these two parts are not in the same line, that's why the point of junction of these two parts, there is a slight narrowing of bony meatus known as the isthmus. This isthmus is so much important because in most of the cases foreign material stuck in that portion. Anterior to isthmus is the anterior recess. It acts as a pool for the discharge of external and middle ear infections. Coming towards the last part of the external ear, that is the tympanic membrane. It is the partition between external acoustic canal and the middle ear cavity. Its superior portion is slightly more lateral. Now, this 0.1 mm thick tympanic membrane is further divided into three layers. The outer epithelial, that is the continuation of the epithelial of the meatus. The inner mucosal layer, that is the continuation of the mucosa of middle ear cavity, and the middle fibrous layer, which basically encloses the handle of Malleus and is further three types of fibers: the radial, circular and parabolic fibers. We divide the tympanic membrane into two parts, pars tensa and pars flaccida. Pars tensa contain the thick middle fibrous layer which give it a tense appearance. There is a groove surrounding the pars tensa known as the tympanic sulcus. A fibrocartilaginous ring called the annulus tympanicus fit in this sulcus. This pars tensa forms most of the part of the tympanic membrane. There is a central elevation in this pars tensa because of the attachment of tip of Malleus, a bone of the middle ear cavity. That point is known as the umbo. The attachment of the handle of Malleus give a flask shape appearance on the pars tensa. When we examine the pars tensa with the help of otoscope, then there is a portion that reflects the light. This is known as the bright cone of light. It is mostly present in 5 o'clock position. This position is important because it becomes abnormal in many diseases. Now, the attachment of lateral process of Malleus causes the formation of anterior and posterior malleolar fold. which encloses the pars flaccida and separate it from the pars tensa. Pars flaccida, also known as the sharpenal membrane. There is a small defect on the posterior lining of annulus ring known as the notch of Ravenous. Coming towards the relation of the external ear, as we know that the brain is present superiorly and ear is continuous with the face inferiorly. That's why superiorly middle cranial fossa is present, inferiorly is the parotid gland, anteriorly is the temporomandibular joint, while posteriorly mastoid ear cells are present. Coming towards the nerve supply of the external ear, first we will discuss the nerve supply of pinna. Great auricular nerves supply most of the medial surface of pinna and the posterior part of the lateral surface. Lesser occipital nerve supplies the upper medial surface. Auricular temporal nerves supply tragus and crus of helix, while the auricular branch of the vagus nerve supply the medial surface of the concha. Now, the nerve supply of external auditory canal. The auricular temporal nerve supplies the anterior wall or roof, the posterior wall or roof or floor. Now, in the nerve supply of external auditory canal, the anterior wall or roof is supplied by auricular temporal nerve, the floor or posterior wall is supplied by auricular branch of vagus nerve, the posterior wall is supplied by the facial nerve. In nerve supply of tympanic membrane, the anterior half of lateral surface is supplied by auricular temporal nerve. Auricular branch of vagus nerve supplies the posterior half of lateral surface, while tympanic branch of the cranial nerve 9 supplies the medial surface.